Welcome to today's in-depth video on Lotepred-T Eye Drops, a widely used ophthalmic solution that combines Loteprednol, Etabonate, and Tobramycin to treat various eye conditions. If you or a loved one has ever suffered from eye inflammation, infection, or post-surgical complications, this video is for you. We will break down everything you need to know, from how it works, its medical uses, side effects, precautions, and even how it compares to other eye drops. Make sure to watch till the end, as we'll also answer some common questions to help you make informed decisions. Lotepred-T is a combination of Loteprednol Etabonate, 0.5%, a mild corticosteroid that reduces inflammation, and Tobramycin, 0.3%, a broad-spectrum antibiotic that fights bacterial infections. Why this combination? Many eye conditions involve both inflammation and bacterial infection. Lotepred-T provides a dual-action effect, reducing swelling and fighting bacteria simultaneously. Before we dive into the details of how Lotepred-T works, it's important to understand why a combination of steroid and antibiotic is beneficial. Many eye conditions involve both inflammation and bacterial infections, and treating one without addressing the other can delay healing or lead to complications. Lotepred-T provides a two-in-one solution, making it an effective treatment for multiple eye problems. Loteprednol Etabonate's role: blocks inflammatory responses, prevents redness, swelling, and discomfort. Tobramycin's role: stops bacterial growth by inhibiting protein synthesis. Effective against Staphylococcus, Streptococcus, and Pseudomonas. How quickly does it start working? Within 24 to 48 hours for inflammation relief? Within 5 to 7 days for full bacterial clearance? Understanding the uses and indications of Lotepred-T is crucial because it is not meant for just any type of eye irritation. It is specifically formulated for conditions involving both inflammation and bacterial infection. Let's explore some of the most common medical scenarios where this eye drop is prescribed. Lotepred-T is prescribed for: first, post-cataract surgery recovery, reduces post-operative inflammation and prevents infection. Second, bacterial conjunctivitis with inflammation, fights infection while relieving redness and swelling. Third, blepharitis and keratitis, controls inflammation and bacterial overgrowth on the eyelid margins. Fourth, post-laser eye surgeries like LASIK and PRK, helps manage discomfort and lowers infection risk. 5. Eye trauma or injury-related inflammation, prevents complications while promoting healing. And 6. Chronic uveitis or iritis in mild cases, provides symptom relief in long-term inflammatory conditions. As with any medication, Lotepred-T eye drops come with certain risks and side effects. While most users tolerate it well, it's essential to be aware of possible reactions so you can take appropriate precautions. Let's go over both common and serious side effects to help you make informed decisions. Common side effects of Lotepred-T are usually mild and temporary. These include a temporary burning or stinging sensation, mild blurred vision, and increased sensitivity to light. However, there are less common but more serious side effects to be aware of. These include eye pain, redness, or discharge, which could be signs of an allergic reaction. There's also the risk of increased intraocular pressure, which could lead to glaucoma if the drops are used for a prolonged period. Additionally, cataract formation is a possibility with long-term use. Who should avoid Lotepred-T? Well, patients with fungal or viral eye infections, such as herpes simplex, should steer clear. Those with glaucoma should only use it if prescribed by a doctor. And people with a history of corticosteroid-induced pressure increases should also avoid it. Lotepred-T is often compared to other eye drops like prednisolone, maxitrol, and ciprofloxacin. While prednisolone is a stronger steroid used for severe inflammation, Lotepred-T is a milder alternative with fewer side effects, making it safer for long-term use. Maxitrol combines a steroid and an antibiotic but contains dexamethasone, which has a higher risk of increasing intraocular pressure compared to Loteprednol in Lotepred-T. Meanwhile, ciprofloxacin is purely an antibiotic and lacks the anti-inflammatory benefits, making Lotepred-T a more comprehensive treatment option for conditions that require both infection control and inflammation reduction. We often get a lot of questions about Lotepred-T, so let's address some of the most common concerns. These answers will help clear up any doubts you might have and ensure you're using your eye drops safely and effectively. 1. Can I use Lotepred-T for viral infections? No, it is only for bacterial infections. 2. How long should I use Lotepred-T? Typically 7 to 14 days as prescribed. 3. Can it be used in children? Only under strict medical supervision. 4. Does it cause blurry vision? Temporary blurring can occur, but it usually resolves quickly. And 5. Is it safe during pregnancy? consult an ophthalmologist before use. To summarize, Lotepred-T is a highly effective combination eye drop for inflammation and bacterial infections. It offers a safer alternative to stronger steroids while still providing fast relief and protection. If you found this video helpful, don't forget to like, subscribe, and share with others who might benefit. Drop your questions in the comments.